My name is Dr. Hussain Kolachi, and today we are just discussing the World Health Day 2023, which was celebrated on 7th April. But we in Isra University celebrated earlier because of the Ramzan and the leaves of the student in the Isra University. So 23rd March we celebrated the World Health Day. I presented a few points about the World Health Day. So the same presentation is before me, and I am just giving you the highlight. The theme of the World Health Day was health for all and improvement of public health during 75 years of working of World Health Organization, or 75th anniversary of World Health Organization was also falling on the same date of the 7th April, because WHO was founded on 7th April 1948. Since then, the work for good health, or the highest achievement of the health and health of the vulnerable and peace of the world was the main theme, because WHO was immediately founded after the Second World War, which ended in 1947. So today the theme is health for all, and this was basically a theme of the primary health care in 1978, and then again the universal health coverage in Astana Declaration in Kazakhstan, the another city near the Alma-Ata in the same country, which is now independent country. So Astana Declaration is also part of the World Health Organization, as well as health for all is the overriding theme of 1978 Primary Health Care Convention, or health for all, as well as the same is universal health coverage and health for all in the Astana Declaration. Apart from this, the awareness is created on various health issues by the WHO. So one of the quote which I was presenting in the World Health Day presentation was the Gautam Buddha quote: "Health is the greatest gift and containment, as well as greatest wealth and faithfulness for the best relationship." So if you want to have a relationship with the nature, with the society, with the country, with your fellow being, the health is paramount importance. Then I discussed some of the achievements of the World Health Organization in the field of public health, and I am just repeating few of them from the literature. The vaccination is one of the very important tool to bring the health at a global level, and the equity as well as availability, accessibility, the vaccine preventable diseases, particularly the smallpox was eradicated, and now polio is just in 2 countries, and we are about to eradicate from the world. Pakistan and Afghanistan are the 2 countries. Then the major the motor vehicle safety has increased because of the road network, traffic, and lot of other vehicles used in the transport, whether it is a goods transport or whether it is essential medicine transport. The sea routes are there, the air routes are there, the land routes are there, as well as nowadays inter-border or multiple roads are crossing just like the rivers in the world. So safety of the road and vehicle, particularly motor vehicle safety, has been increased. The use of helmets, and other signals and the construction in the roads, all these are leading to the, as well as the training and certain international regulation. Then safer workplaces are available nowadays. Control of infectious diseases is very important, and then the decline in the death due to coronary artery diseases and smoking related diseases. Safer and healthier foods are available now, though there are many other eating habits and behavioral problem, but safe foods are available, and most of the nutritional diseases and the food fortification is part of that strategy. Then the healthier mothers and babies, this is MCH services are there. The infant mortality, the maternal mortality has been decreased. Family planning services are available. Fluoridation of drinking water, and even the chlorination of the drinking water was earlier started. Recognition of tobacco use as a health hazard. So these were the few important things. Then I discussed about the blue zone, which is a new concept in the health. And the blue zones are area of the world where people live the longest lives, consistently reaching age 100 or above. So these are the zones, and why these people are living the 100 years plus life, while the US currently the life expectancy is 77 years. So almost about 23 years difference is there. So the according to the CDC, Buettner and his team identified 5 such blue zones, and these zones are mentioned in the literature. I am just quoting some of the zones. One is Ikaria in the Greek, second is Ogliastra, Sardinia, Italy, Iceland, and then is Okinawa in Japan, and Nicoya Peninsula in the Costa Rica, and Seventh Day Adventist in Luma, India, hilly valley of California. So these are the 5 zones where people are living, and we call it blue zone or blue zone health, where you have plenty of spaces to walk, to play, to relax, and lot of greenery is there, less traffic is there, and people, their diet and their life pattern is simple, and they are living in the families and in a serene and a comfortable life, and they are having a surveillance, as well as the research has shown that there is no deafness, there is no cataract, there is no cardiac problem, no hypertension, and even at the 100 years they are living a very productive and effective and a very satisfied life. Then the disease as defined by the WHO is health is a state of complete physical, mental, and social well-being, not merely the absence of the disease or infirmity. So only absence of disease is not health, and health is a multifactorial understanding or a scientific method which you can apply. And then coming to the some of the Indus Valley civilization public health mention was there, and I have quoted in one of the article published from India, the Journal of Family Medicine, which says that they were held in the highest ethical standards of the day and were bound by a strict code of conduct. This was the training of the physician in Indus Valley. Normally they refer as India, but India is also part of the Indus Valley since centuries. And after this 1947, The India and Pakistan are the two countries. Otherwise, these both are called Indus Valley civilization. They underwent rigorous training in both medicine and surgery. Most physicians were multi-skilled journalists, means they can treat almost many diseases in the same setting, and expected to be skilled in elocution and debate, means they were good in communication, what we are now understanding as soft skill. They were reasonably well off financially, means they were well off and they were looking after their families and community. The paper also briefly traces the evolution of medicinal ideas in ancient India, means Indus Valley civilization around the Indus River. This is before the Christ. This is a BC in Gupta period, as well as we call it Shashrut or Shashruta, a father of surgery, and even the Mohenjo-daro public health and drainage system, spacious houses, planned cities. They also show that every house has drinking water facility, as well as there is a great bath. So all these are public health measures in Indus Valley. So on this day, I thank the WHO Director General Dr. Tedros, as well as the Regional Director Dr. Ahmad Ali Mandhari of EMRO, and Dr. Mahipala Palitha Mahipala, country representative of Pakistan, and the Sindh Regional Office Dr. Sara Salman. Their efforts are appreciated, particularly in the flood affected areas, and 160 health facilities are now planned by the WHO to be rehabilitated and reconstructed by WHO. So we thank once again and congratulate the WHO team, its Director General, its regional directors for their good efforts. Dr. Hussain Bashkolati YouTube channel once again appreciates and all those health workers who played the role in eradication and during the COVID pandemic, and even the ISRA University was in forefront, and Liaquat University also worked very hard in the COVID along with NCOC as well as the government of Sindh and government of Sindh. So once again, WHO 75th anniversary, well done. And as the Dr. Mandhari has said, that we are feeling proud of 75 years work of the WHO, but we also look forward for more 75 years to do more in the arena of the health, as well as for the vulnerable communities and for the peace, particularly in the Muslim countries. Their focus will be well appreciated, along with all the countries where we need the help of the WHO and guidance. Dr. Hussain Bashkolati YouTube channel once again thanks you, and please do subscribe, send comments, as well as any suggestions from your side. You are welcome. Thank you very much.